All right, thanks, John Paul. Okay, so today we're going to be doing C-spine and T-spine. So for the C-spine for practicum, we're gonna do AP, axial, open mouth, and then lateral. I'll go over the obliques of the C-spine and then the flexion and extension views as well, because you will use those frequently in the real world. But for practicum, we're going to do the acute pain series, which would be like car accident, a fall, something like that. And that's the AP, the open mouth, and the lateral, okay? And then for T-spine, we're going to do swimmer's view. That looks from C5 to T3. We also can use that for C-spine, but for practicum, we're gonna do it for T-spine, and then AP and lateral, okay? For the practicum, everything will have 3 views. So on this practicum, it'll also have the L-spine, the sacrum coccyx, and the SI joints, but we'll do those ones next week, okay? So let's go ahead and start with the C-spine first. So we are going to use a 10 by 12 image receptor for the 3 views of the C-spine lengthwise, okay? So it's going to go in here 12 top to bottom. And then I'll have my victim come and cut his back against the board here. So for the APC spine, we're going to use a 15 to 20 degree cephalad angle. So we're gonna go with 15. So right about there. I'm not going to blind you. For the practice, oh, I did blind you anyway.
Into the light.
For the practicum, we want to make sure that we have our patient take off any jewelry. You're fine right now. Any jewelry, glasses, anything like that. If they have a collared shirt on, we would have them take that off as well. And then for this though, we're going to center at the level of C4. We know that C4 is about the top of the thyroid cartilage, so the top of the Adam's apple. Okay, so I'm gonna have you come this direction just a little bit, right about there. And we want the chin up, perfect. We want like good posture chin up. We don't want the chin way up, but we don't want it down as well, okay? So I'm gonna line up my Bucky, coming up behind you. And make sure because of the angulation, we're not worried about our image receptor being lined up here on the wall Bucky. We want it in line with the handle, right? So I'm good there. I'm at about the level of C4. We want the light field to be coming above the, I'm gonna come down a little bit. We want the light field coming above the ears to the EAM, okay? And then we wanna make sure we're seeing some of the T-spine as well. So you can probably collimate top to bottom a little bit more. Good, and then we're going to roll the shield in front of our patient here. And then my left marker, which is up here, can go on the left side of my patient in the light field. Right there. So, left marker's here in the light field. I'm centered at C4. Come just a hair to the left, right? Right there. So we're in the midline, chin up, 15 degrees cephalad angle. That is my APC spine. We're just gonna have our patient hold their breath, okay? Don't breathe, don't move, and x-ray, okay? The next view is going to be the open mouth view. So for this one, I'm going to put gloves on. 1, because I don't like people touching my face without gloves, and 2, I don't want to put my fingers behind people's ears without gloves. That is a place that lots of people seem to forget to wash. Not saying you forget to wash, but.
No potatoes growing.
So, I'm gonna take my angle off here, and I'm gonna go ahead and set my collimation to be about 7 side to side and 5 top to bottom. This is just so that I'm already kind of shrunk down so that my patient, I'm not blinding him when I go up to his face, okay? So we're going to feel with your pointer fingers for the patient's mastoid tip, which is a bony bump behind the ear, okay? It's part of the occipital bone, and it's right here behind the ear, so we're gonna feel for that with our pointer finger, and then with your thumb, you're going to feel for the bottom of the upper incisor, okay? So you can feel it through the mouth, or through the lip, I mean. So, I'm gonna bring this up a little bit. And the point here is when we find that mastoid tip in that upper incisor, we're gonna tilt the head back and forth until you have that in a straight line with one another, perpendicular with the image receptor. Okay, and what that's doing is getting the base of the skull and the upper teeth in line with each other so that we can see the odontoid process through the middle of the mouth, right? So, come a hair higher here. I'm gonna bring this down a smidge. Okay, so I'm gonna go ahead and feel right here behind your ear, and I'm gonna poke here on the front of your mouth. Okay, go ahead and tip your head down a little bit. So right here is his upper tooth, and here is this, and we have a straight line coming through. Now it's important that you hold your patient's head in place and then tell them to go ahead and drop their jaw open as much as they can. Good, and then they say, ah, and we take an x-ray, okay? The reason I keep my hands on the face while I have them open their mouth is because if not, a lot of people tend to go and tip the head back when they open their mouth. So hold their head like that, have them open their jaw as much as they can, and then you're still keeping everything in line. Does that make sense? So when he opens his mouth all the way, I'm centered there in the middle of his mouth. The ah helps bring the tongue down so that it's out of the way of superimposing over the odontoid process as well. Okay, makes sense? And then my marker is just out on the outer side, so I can open this side to side a little bit more. And I have my marker on the left side of his head there. Okay? So questions about those two? Say P-axial 15 degrees at 40, and we do the picture and then take the angle off, and now we're centered in the middle of the mouth. Okay? For the lateral, we're going to go out to 72 inches. And we're still 10 by 12, so we're gonna open back up now to be 12 top to bottom on the 40-inch line. And 10 side to side on the, on the 72-inch line. So, out to 72 here. And I'm gonna have my patient turn and face the left for me. And we are still sitting at the level of C4. So the top of the thyroid cartilage. I can collimate top to bottom a little bit, and go ahead and relax your shoulders down as best you can. Let your arms come down to your sides, and then step forward. Only a little baby step. There you go, because we want to be centered more on the spine, okay? So we're right there, have light field coming behind, and I'm gonna line this up. So no angle. We want to make sure we're seeing the EAM, which is the external auditory meatus, so the ear hole, okay? And then we have light coming down onto the shoulder. Over here more there. We're at the level of C4, and then we're going to tell our patient to relax their shoulders down, blow their air out, and hold it out. That expiration helps get the shoulders even lower, okay? And then, again, we're centered here at C4, coming through. My marker's there in the anterior portion, and that is my lateral C-spine. Questions about that one? Okay, so still at C4, make sure we have the EAM, make sure we're seeing below the C-spine, which we know C7 is here. So as long as I have light coming below that, then we're seeing part of the T-spine.
Okay. And these are all 10 by 12?
All 10 by 12 for the C-spine, yes. Okay. So those are the three views for the C-spine practicum. Now for the T-spine, we're gonna go ahead and start with our swimmer's view. So our swimmer's view is a 10 by 12, so I'm not gonna change that. It is the book says between 60 and 72 inches for SID. We're gonna use 72 for practicum because I don't have a 60-inch marker on the floor. Okay, so we'll just leave it at 72 and that's fine. We're going to do a 5-degree caudal angle. So just a little baby bit 5-degree caudal angle, okay? And what this does is when we're doing this caudal angle, it helps to slice through between those shoulders, okay? Because that's the point, is we're trying to get between the shoulders to see that portion of the spine. So the book shows the patient bringing their left arm up and over their head. I don't really like this because I feel like it helps the patient ends up tipping the head and you don't end up with your spine straight. So I like to have my patient bring their left arm up and place it on top of an IV pole or a handle that the x-ray tube will have. And then the right arm is gonna come down and back. So kind of like you're reaching into the back seat of the car. Try to relax it back. There you go. You know, John Paul with his neck issues as it is. You're a great patient for this. It's like you've done it before.
Recently done this.
Yeah. So go ahead and scooch forward for me just a little bit. And our center here is C7, okay? So what I like to do, C7, we can feel that vertebral prominence on the back of our patient. But as long as we're centered to like where we're skimming on the top of the shoulder, where the shoulder and neck meet, you'll be at C7. Does that make sense? So my line is right about here. Again, relaxing that shoulder down, lining this up, and then having my patient get all the way against the image receptor so that we minimize that OID and we minimize any motion that they might have. And then this one is still an expiration. So blow your air out and hold it out. So swimmers is left arm up, right arm down and back, 72 inches, 5 degrees cauda so that we're coming and cutting through, and then blow your air out, hold it out. Good? And we're centering again at C7 where it's just skimming onto the shoulder. All right, go ahead and relax for me. I'll bring this down and take the angle off. Okay, we are going to move on to the AP and lateral T-spine now. So for these, we're going to switch to a 14 by 17. And, wow, I think it's my first day. Okay, there we go. 14 by 17 lengthwise, because my spine is long, not wide. And I'm gonna have my patient put, well, before we get there, I'm actually gonna have you step to the side for me. Like into the corner for me. Just for a moment, because I'm going to show this. So for T-spine, we are going to come in to 40 inches again, okay? And I'm on the 40-inch line. I'm set at 17 top to bottom. And I'm only at about 7 side to side, okay? That's because we don't need to see the whole width of the chest. We just need to see the spine. I like to leave it open a little bit in case of any like curvature to it, anything like that. But your marker, if you get it set at 14 by 7, or 17 by 7, we can stick my marker, thank you, up here in this top corner. And then it can live there for the AP and lateral image. Okay, so I have a left marker up there in that top corner. Now I'm gonna have my patient come and put his back against the board for me. And we are centering at the level of T7. T7 is in line with the inferior scapular angle. If we were to bring my inferior scapular angle around to the front, that puts you at like an average nipple line. Like if you had just a anatomic skeleton person with nipples, you would be at about the nipple line, okay? And so we need to make sure that we're seeing above the jugular notch anteriorly, but that's going to be about that level, okay? So right about there. I'm gonna bring this up behind you. Make sure I'm lined up. Again, 17 top to bottom is not gonna change. I'm gonna poke on you and find your jugular notch. I'm centered to the midline. And I'm gonna have you just put your arms at your side. And this one is going to be expiration still, okay? So blow your air out, hold it out, all right? So centering at T7, I have light field coming above the jugular notch. We're good side to side. This is my AP. Okay, once that AP image pops up, we can then see where my lumbar spine starts, right? Because we'll see where a rib is not attached. So that's L1. Count all the way up. We're able to know we have all 12 of our thoracic vertebrae. If you have a good AP image, then our patient, I'm not going to touch anything. I'm just going to have my patient turn and face the left. And I want you all to do something for me. If you bring your arms up, feel what your shoulders do. So if your arms come up over your head, do you feel where your shoulders are? Okay, now push your arms forward like you're pushing an IV pole forward. Do you feel where your shoulders are? They're pulling away from your spine, right? So really stretch your arms forward with that. So do you feel how your shoulders push away from your spine? So that's how we want our patient's arms for a lateral T-spine. And we're going to go forward a little bit more. A little more. Okay, right there. And then step all the way to the left. Good. So for our centering here, we're centering between the mid-coronal plane and the posterior portion of our patient, okay? And what I want your light field doing is it's just kind of caressing over the back. We don't want, I'm gonna kind of push forward a little more. We don't need extra light back here because there's soft tissue, there's muscle, there's fat, there's these layers between the spine and the outside world. So as long as we see that light kind of hugging over, if you will, then you're gonna be fine. Okay, your breathing instructions for this are going to be slow, deep breaths in and out through a straw because we want to blur the ribs. Okay, so it's a long exposure. Make sure that that left shoulder is touching the bucky to help minimize movement, and that is your lateral T-spine. So from AP to lateral, the only thing that's changing is you're just moving your patient. Don't touch anything else. Don't open your collimation, nothing, because we have our beam divergence. So when John Paul steps forward out of the way for me, please. This is how wide we're exposing. Like you're still going to get this exposure even though your light field looks smaller because of the patient being closer to the image receptor or the tube. Okay, good? All right, perfect. I will show you guys the other views that are not